You know, the zoonotic diseases will be there now with us for a long time because one thing we've discovered is that these zoonotic diseases will be recurring, especially after every rainy season. We will find this, especially the Rift Valley fever and the rest. And they affect the humans also. I think you are aware of the recent outbreak that took place in the county. And yes, we have handled as a government with the support of the partners and the stakeholders. But you know, that is not enough because it will be recurring. Our appeal is to the partners also, so that at least through the Kenya Medical Research Institute maybe, because that is a well-known institution, that a research is done and a long-lasting, remedy for this is found. Because if something is always recurring and we don't have the vaccination for this, then it's a problem for us in the county. Not only our county, because most of the pastoralist counties like Marsabit, Moyale, not Marsabit, Samburu, Wajir, Mandera, and the rest, where all the livestock can be found easily. These diseases can always be recurring. Like we had a case in Wajir, we had a case in Marsabit, so you see, we might have a case in Samburu, we might have a case across here in Ethiopia, you see. So we appeal to the national government, to the partners also, so that at least we can have a long-lasting solution to handle such zoonotic diseases. Most I want to appreciate so much the IGAD team for preparing and even calling for this workshop. That is very important. We are here today to at least learn about the policies that IGAD is handling, that is touching so much the cross-border communities that are living here in Moyale, Kenya, and Moyale, Ethiopia. We are also privileged to be together with the leadership and the stakeholders from Ethiopian side, because the issues that are here has to do with the livelihood of our people. And as I said, these are issues or policies that really affect the livelihood of our people. We are basically pastoralist communities. As Marsabit County, we know very well that more than 80% of our people are dependent on pastoralism. So the issues that are affecting our people here that are addressed by these policies are like the camel policy that we have, trashumans, the rangeland management policies. This has to do with us because we are the people who are keeping camels here. And being camel keepers, we know very well that these are very resilient animals that we have in the county. We know very well that these animals have survived even the most the recent drought that really affected our people. And I want to say from onset, these policies, like you have understood very well that we have diseases that are affecting our animals, the livestock that we keep around. And according to our people, this border that we have here is imaginary thing, because we live across Ethiopian side and Kenyan side. This border thing is not in our mind. So whenever there is drought, whenever there are challenges of lack of water and pasture, we cross either of the side. We either cross to Ethiopia or we cross to Kenya because of our animals in search of those necessary grass or water. And so in the process, sometimes there is outbreak of also diseases. There is also conflict. There are a lot of challenges here, especially now that we also have the climate change thing that is really affecting our people. We know very well that these policies are going to address the most pertinent issues that are affecting our people. Like the camel policy. Those who are camel keepers here, the Rendiles, the Gabras, and of recent even the Boranas and the rest who keep animal, the camel. I know we've not improved so much in terms of value addition to the camel milk and so on, but we depend so much on this animal. It's also a sacred animal. So this policy is going to help our people. As a county, we know very well, first of all, that we need to cooperate with our partners and the stakeholders in these areas, because livestock, agriculture are the basis of our livelihood. So, and I'm happy that we have the officers, the technical people from the department in this workshop, and I know they will have to go through the policies properly and understand, and also contribute in terms of ideas.
And the disease which is of very economic importance currently is Rift Valley fever. Recently, it was detected in Marsabit County, and an alert was made within the region. This is a disease which was discovered a long time ago, but because drought used to have long cycles, like drought comes in 10 years. So the development of vaccines to control them, because it is floods. After droughts, you will get a El Nino effect and then the flooding. It's flooding which causes outbreak. So the production of vaccine has been very slow. I think now with the climate change, with those flooding being frequent, then the outbreak will be very frequent. And Rift Valley fever has a lot of importance in terms of human life and also the economy, because like the last outbreak in the 1997 El Nino, there was Rift Valley outbreak here. Our livestock, our meat products were banned in the Middle East. Middle East is a very good market for us. Middle East, Saudi Arabia, Middle East started relying on Australia for meat imports, and that is very colossal. So in order to safeguard lives and livelihood, this vaccine needs to be brought into production as quickly as possible. I think a lot of efforts have to be put into that area.
It is one of the Asal County, and it's one of the counties that is affected by the climate change. We are experiencing the burden of climate change, starting from the prolonged drought, the floodings, resource-based conflict, and because of all these, the livelihoods of the community has been affected. If you look back 2013, whereby we came from a prolonged drought of 4 rain failure seasons, that tells a lot, that people have lost a lot of livestock. And looking, when we had the rain in 2023, we have enough water, we have enough pasture, we have fewer livestock. And looking at all these burdens, there's another new burden now, the zoonotic diseases. And these zoonotic diseases are coming up because of the variation of rainfall patterns. We have more rains now in 2023, and moving forward to 2024, we are in now, we'll have more rainy season. And because of this variation, it brings a favorable environment to a vector, because Rift Valley fever, which is burdening now, there's a lot of outbreak as one of the zoonotic diseases in this county, is burdening the health of the livestock and the human being. And all of this is brought up by the variation of the rainfall patterns. And the vector mosquito that is spreading the disease is now getting a warmer environment, a more wet environment to spread the disease. And as we are going to 2014, which we have now more prediction is saying we will have more rainfall, meaning that the spread of the disease will be more. So looking at the loss of livelihoods, that we don't have enough livestock, the food insecurity, and burdened by the zoonotic diseases, that tells a lot the loss and damages that these communities are experiencing.